Republicans faced a similar dilemma back in the 90s. Medicare was running out of money, and a Democratic president, Bill Clinton, with the help of liberal media, attacked them for wanting responsible solutions. So what lessons can we be learned from the 1990s? Joining us now is former Louisiana governor and congressman who also served as Assistant Secretary of Health and Human Services, Bobby Jindal, who has written an opinion piece about the topic along with former House Speaker Newt Gingrich. Governor Jindal, good to see you. Thanks for being here with us.
Don, thank you for having me. It's great to be on the air with you. Look, it feels like we've seen this movie again. You can almost imagine the 90s ads coming back where grandma's in a wheelchair rolled off the cliff with the Republican congressman pushing her off the cliff. This is the same old, tired Democratic playbook. You know, they run out of ideas and they run out of things to say. They accuse Republicans of attacking Social Security, Medicare, and there they go again.
Yeah, so you had RNC Chairwoman Ronna McDaniel once again having to explain the position. I want to show you how she responded yesterday.
Speaker McCarthy and Leader McConnell has said it's off the table. And to see President Biden go in front of the American people and try and scare them was something that he knew wasn't true. It was a lie. Republicans are going to make sure that we honor our commitment to Social Security and Medicare.
Look,
all right, so Republicans faced basic... So let me just ask you, though, I mean, how similar is the challenge from the 1990s to the challenge that we face now and sort of the solutions that we use then to the solutions now?
Sean, the challenges have gotten even worse. We have more baby boomers now in the Medicare program. The math gets worse. Let's be honest. The Democrats, by attacking responsible solutions, are ignoring the fact that Medicare's trust fund, the Part A trust fund that pays for hospital visits, will run out of money if we do nothing by 2028. That would mean an automatic 10% reduction. What that means is fewer providers in the program, longer wait times. That means rationing of care. So let's be honest, President Biden, by attacking responsible reforms, is the one that's actually advocating for a benefit cut. Here's what we can learn from the 90s. There are responsible changes we can make to modernize, to improve the program that don't raise taxes, that don't cut benefits. 3 quick examples. So number one, right now, Medicare, not many people realize this, Medicare has got this quirk where it pays more to hospitals for outpatient care than it pays for physicians. And if you just equalize those payments, MedPAC looked at this, they recommended over 50 procedures, said it makes no sense to overpay outpatient departments and hospitals. You could save the program over $150 billion over 10 years, but even better, you would save seniors almost $100 billion in cost sharing over 10 years. So what's happening today is hospitals are buying these physician practices, getting increased payments from Medicare for doing the exact same procedures that you could get done in a doctor's office and in an ambulatory outpatient surgical center. Secondly, Medicare fraud. Nearly 7% of Medicare spending is wasted on improper payments on fraud. That's over $40 billion a year. Compare that to the credit card industry. Less than 0.5% is lost to fraud because in the government, we chase after fraud instead of preventing it in the first place. So we go and try to arrest people and get the money back, but it's too late. Why not invest more in preventing fraud? And then finally, third, why don't we invest more in preventative care? Why don't we keep our seniors healthy? We've got a sickness system. And so, for example, according to current congressional rules, if you have a preventative intervention that doesn't save money in 10 years, they won't do it because that costs them money. So what we propose, the speaker and I proposed in our op-ed, and there's legislation in the Congress that would do this, why not look at a 20 or a 30-year window? For example, we know that heart disease is the top killer in America. We know that we have an issue as a country with diabetes, with weight issues, with obesity. Why not invest more in keeping people healthy and not only paying when they get sick? 3 simple ideas. There are others. For example, we reform the way we pay for bad debt. These are simple ideas, would save tens and hundreds of billions of dollars, wouldn't cut benefits, wouldn't raise taxes, wouldn't hurt beneficiaries. So what they did in 1997 with the Balanced Budget Act, it helped not only to extend the lifespan of the trust fund, it was also endorsed by the AARP. Now think about that. Republican congressmen craft a bill that a Democratic president signs. It rescues the Medicare program. Even the elderly lobby, AARP, endorses it. But for this to happen, President Biden's got to stop playing politics with Medicare. He's got to stop scaring seniors. He's got to stop being irresponsible.
Okay, Governor, so you lay out these few ways that, you're not cutting and you're able to reduce cost. So at the end of the day, why isn't there agreement on these simple things that you laid out in your op-ed? Only have a minute left.
Well, look, President Trump tried to do the site neutrality payments, the first thing I mentioned. It's the old DC swamp. They're entrenched lobbyists. They're entrenched interests. When you do something like that, there are people that are benefiting from the corruption, the waste. They don't want to see that change. But I think we can get this done today if the Democrats will lay down the political weapons. They'll be honest with the American people, say doing nothing is not an option. The program will go broke if we do nothing. If they say Republicans want to protect seniors and beneficiaries, and we're willing to work with them to do that. For that to happen, Democrats have to be honest and give up the partisan attacks. I'm hopeful, but look, they've not done this before. This is one of their go-to moves. Biden's not doing great in the polls. This is an easy scare tactic for them. For this to happen, the Democrats have to stop attacking Republicans and work together to protect seniors.
All right, we'll see if they can do it. Governor Bobby Jindal, thanks for being with us. Appreciate your time.
Thank you for having me, guys.